Thank you. I'm going to be speaking on the primary health care and the control of COVID-19 in Kazakhstan and Central Asia, and also provide an overview of what's going on in primarily Kazakhstan, because I have the most valid and most reliable data on that country. So if we're looking at Central Asia here, the Central Asian countries are all north of Pakistan and India. Just to give you a context, that includes Kazakhstan, Uzbekistan, Kyrgyzstan, Turkmenistan, and Afghanistan. But the data that I will be providing will be primarily in Kazakhstan. Now, as you look here, this is the biweekly change in confirmed COVID-19 cases as of September 25th. It hasn't changed much, 2020. So what we have here, if you notice, that it's a light blue, so there's actually been a decline in the biweekly change in confirmed COVID-19 cases as a result of soft lockdown and changes in behaviors and social gatherings. Next, what's going on? Why is it freezing up? Okay. I'm freezing up here. Just a minute. There we go. Okay, so what we have here, let me move this out, is a situation where we have biweekly cases per million people. If you notice, we have a number of countries in South America that are really struggling, including Argentina and Peru. And in addition to that, the United States is having difficult times in some parts of Europe. In the case of Central Asia, if you notice, in Central Asia, that there is Central Asia, that it's a light pink, so the biweekly cases per million people is reasonably low, at least based on confirmed cases. And we'll talk a little bit later about how well confirmed cases actually reflect the true number of cases. So what I'm going to briefly do is talk about the role of primary care in Central Asia to control the pandemic, and where Kazakhstan has been and where it is now in the pandemic. So the role of primary care currently, and that will evolve and develop further as the pandemic continues in Kazakhstan and Central Asia, first is triage. If you have very mild cases of COVID-19, you're much more likely to be sent home. Because of the limitation of test kits, you're probably not going to be tested. You won't necessarily be counted in the surveillance, but you'll be given instructions and given education on how not to infect other people and how to best take care of yourself at home. If there are more complicated